Back to Twin Cities Live. An Edina cardiologist says she believes there's a place for medication when it comes to treating heart disease, but says changing your lifestyle is really the key to living a longer and healthier life.
Dr. Elizabeth Klodas gave TCL reporter Kelli Hanson a tour around the new Preventive Cardiology Clinic. It's more than a doctor's office. It's a clinic where patients are learning how to live and not simply rely on medication.
Hi, good to see you. How are you?
Good.
Okay, so we're going to check your blood pressure and I'm going to listen to your heart and your lungs.
This is a dream for you.
It is, and I get to wake up every morning and be excited about what I do. So this is so it just keeps going, and it's a large interventional space. So this is where patients recover after their procedures. I'm super proud of our clinic. It's state of the art. We've just opened and renewed it. The whole idea is to help patients maximize what they can do for themselves in terms of preventing heart disease.
You basically want people to not have to come see you. That's the idea,
actually,
right?
my greatest success would be to be out of a job, and it's because the data shows 80% of heart disease need not exist. That's not a wish; it's a fact. There are communities around the globe where people, where heart disease is essentially unknown, and the difference between them and us is not the number of medications that they're on or the procedures that they've had, it's how they live.
What kinds of things can a patient expect to go through here, to experience here at the clinic?
Well, for one, a pretty long evaluation with me. So I typically spend an hour with a new patient, really delving into not just their health history and their risk factors, but also into their lifestyle habits and where small changes could make a big difference. I try to be very thoughtful in terms of the procedures that we use. Again, much of heart disease can be prevented and solved with the way people live, and that's really my main goal, is to point them in the right direction.
Before we started sitting down and talking, you were telling me that we put the right thing in our vehicles, but we don't put the right thing in our own body. So we treat our cars better than we treat ourselves sometimes.
If you drive up to a gas station, you flip open that fuel tank, it might say, premium unleaded only. What do you put in? Premium unleaded, right? Never think about putting in diesel. That would be bad for the car. And yet we are very complex machines. We require maybe premium unleaded fuel, but we feed ourselves diesel all the time and expect a great outcome. It just doesn't work that way.
You have developed a food line that can help people lower their risk of heart disease. Tell me about that.
Yeah, so, if someone had told me in medical school that one day I'd start a food company, I would have laughed in their face and told them I was crazy. If you look at the risk factors for heart disease, there are 7 modifiable ones, meaning we can do something about them. It's inactivity, smoking, and then there's high cholesterol, high blood pressure, high blood sugar, excess weight, poor diet. Well, of the 7, 5 are related to nutrition. And, so food and what we eat is so important, but it can be difficult. So kind of trying to help people get convenience foods that are actually good for them is the whole idea behind Step 1 food. It's foods that people are familiar with, an instant oatmeal, pancake mix, a smoothie mix, and bars that, some have chocolate, some have fruit. Very easy, and we can do so much with lifestyle, and especially so much with nutrition. It doesn't have to be high cholesterol, here's a pill. It can be high cholesterol, okay, let's see what you can change in your nutrition and your lifestyle, and then let's see what you can do. And sometimes people see amazing results without drugs. I did the medication Band-Aid for years, and I think what I realized was that no matter how many drugs I put people on, no matter how perfect I made their numbers, they didn't look any better, they didn't feel any better. Doesn't mean medications are bad. Again, I prescribe them all the time, but it's such an incomplete solution.
Listen, that is such a smart way to look at things. I love hearing that. That is, people think doctors are just like, here, you got high cholesterol, let's put you on a drug.
Try this.
Well, there's a place for it all, but the lifestyle is really important.
We have a few of these Step 1 food products that Dr. Klodas created here. This peanut butter bar situation is very good. They have apple cinnamon down here, dark chocolate with walnut. In the middle, I'm like devouring the peanut butter bar. You're loving the apple cinnamon bar as well.
I know, I'm loving both of them. So these have been proven to lower cholesterol in just 30 days.
Wow.
And you can find a link to purchase Step 1 foods and more information about the Preventive Cardiology Clinic on our website, twincitieslive.com. And I got to tell you, I mean, I'm no expert.
You're loving them all.
But this is a good ingredient list.
Dr. Klodas, by the way, is accepting new patients. Visit pccmn.com to learn more and to schedule a consultation.
And you can join me and Dr. Klodas live on the Twin Cities Live Facebook page this Thursday at noon. We're going to be answering your questions about heart health. Boy, I can't wait to talk to her. We're going to also discuss how making small changes like skipping a soda a day or taking a few more walks during the week can really make a huge difference.
There's a compound
This
effect.
is great.
Next.